Welcome to part 3 of Senior Moment with Nurse Linda. We're talking about the good news. Give us the good news.
The good news with cervical cancer. Cervical cancer usually doesn't have any symptoms, and that's part of the problem with it. So going to your doctor on a regular basis is going to be the best thing you can do to prevent or catch this disease in its very early stages. Some of the symptoms you might see are abnormal bleeding or spotting, discharge, some pelvic pain, pain low in your pelvis, bloating, feeling of being very gassy, and that's common with any gynecological cancer. A change in your bowel habits can also mean a GYN cancer or change. Any unusual bleeding whatsoever. Uh, Prevention, ways to prevent this disease is limiting your sexual activity, knowing your partner very well for a very long period of time, knowing their history, and use of a condom. Condom does not prevent HPV 100% of the time, just like it doesn't prevent pregnancy 100% of the time. It works the same way. The good news is deaths have been declining over the past 2 years
For cervical cancer?
for cervical cancer, and they're attributing that to better screening. Some insurance plans are actually requiring women to get their cervical screening. If not, they won't cover a problem.
Do they teach this in school?
They do in health class. I don't know to what degree because obviously it's been many years since I've taken a health class, but this is where moms, aunts, grandmothers can help the younger women in their generation family know and understand this. Cervical cancer is curable if it's caught early. Getting the HPV vaccine will help prevent this disease. HPV is not 100% like everything else, but it will prevent most cervical cancers because it prevents the spread of HPV. Not all cervical cancer is caused by HPV, so even if you get the vaccination, you still need to be screened with a pap smear. Some doctors will recommend, depending on your individual circumstances, once a year, and they usually tell you once a year for 3 years if you've had a negative result. Then you can go 3 years if you have no known risk factors, no family history, you're in a monogamous relationship, all those different kinds of things. You haven't had, 15 children. You're okay. The doctor will tell you 3 years.
Octomom is in line for the cervical cancer.
No, she's not.
Why not?
Because she did not deliver her children vaginally.
Oh, she had
a C-section. So that's the difference.
Okay.
Okay, so it's not having many children; it's delivering many children vaginally.
Okay, see there.
Yes, there's a difference there. The other part of this is the treatment for cervical cancer. If it goes far enough, sometimes they can, if you just have abnormal cells at the end of the cervix, they can go in and do cryosurgery. That's in a doctor's office.
Freeze it.
They freeze the cells slough off. You have a little bit of bleeding, it might be a little uncomfortable, but there is no true pain. You feel a little crampy afterwards. But then the idea is those old cells will slough off and new cells will grow, and they will grow in healthy. So you still continue needing to follow up. Sometimes medication if the cells are abnormal. Just a dose of topical medication for a period of time will help with that. It depends on the degree.
Topical.
Just like you would put in a tampon.
Well, I don't know how to do that either.
Intravaginally, you put it in through your vagina,
okay.
Yes. And it's a cream, and you do that for a period of time, and that can. So your doctor will tell you what the best approach is. If it's more serious, if it goes beyond that, the doctor can recommend having your cervix removed. They can recommend a hysterectomy, removing the total uterus. Sometimes radiation to the area is best, and that can be done implanted through the vagina, have what they call radioactive seeds implanted. Sometimes it requires external beam radiation. Again, depends on your situation and your diagnosis. There's also chemotherapy. So if the cancer has spread a little bit further than it needed to, they have some very good chemotherapeutic medicines out there right now.
I was reading an article about a woman who decided not to have chemo.
Mm-hmm.
She said, I'm going to die anyway, and I don't want to die miserable.
It depends on the degree of disease you have. And sometimes chemotherapy is given to just give you a little bit longer lifetime. And people want that because maybe they're looking to reach a goal in their life, get to a daughter's wedding, a grandchild's graduation. So yeah, if you can give me 1 to 2, 3 years, I'll take it.
With
If it's
chemo?
quality of life, yes. And the doctor
Yeah.
can give you those numbers. I cannot. Do not take my information and do that. No.
We're not giving medical advice here, folks.
Absolutely not. And some people will opt, no, you know what, my disease has spread that far, you're only going to give me 3 to 6 months if the doctor says that's what we're going to get from this. And then people will decide not to do that. They would rather have a better quality of life than to risk the potential side effects with the chemotherapy, which can be nausea, fatigue, feeling of discomfort, things like that. So that's an individual decision, and people make that based on their needs, their lifestyles, what their desired outcomes are.
So they can decide, well, I want to see the next TV series, so I'll take this.
Yes.
Yeah, okay.
Yes, absolutely. Now, we do have some information for people who want to get more information on this. They can, of course, always call Brook Healthcare, but the National Cervical Cancer Coalition, the website address for that is nccc-online.org. nccc-online.org. The phone number for that is 1-800-685-5531. 1-800-685-5531. Another good resource is the Center for Disease Control, which is cdc.gov, and I think everyone knows that one by heart. The phone number for that is 1-800-CDC-INFO. Very simple to remember, yes.
CDC.
CDC.
Charlie Delta Charlie.
That's it. And they also have on the CDC website podcasts. So you can go on your computer, choose one of the podcasts, and you can get information on any topic, I think, in the world. I went through those this morning and listened to a few of them. They're very informative.
You go to YouTube,
Yes.
and they have videos of these surgeries.
Yes. Yes.
I find that very interesting.
Yes, absolutely. The one other resource we can give to people is the National Cancer Institute. And that website is cancer.gov, cancer.gov. The phone number for that is 1-800-4-CANCER. Again, very simple.
Works for me.
Yes.
What are we talking about next week?
Next week, we're going to do a little bit on Alzheimer's because January is also Alzheimer's month.
Oh, you told me, but I forgot.
Yes.
You were listening to Senior Moment with Nurse Linda. This is our 3 segments on uterine cancer.
Cervical cancer.
Cervical cancer. Well, same area. And next week, we're going to be talking about
Alzheimer's.
Yep.
Yes.
Yeah, I keep forgetting. The phone number here is 803-941-7231, 803-941-7231. And see you next week, folks.